Secretary RFK may not be taking these vaccines away, but actually in removing mandates and not making them compulsory, that is kind of what you're doing because of how the health system is set up in this country, right? You know, you're relying on your health insurance to cover you getting these vaccines. Otherwise, they are so prohibitively expensive. Hi guys, another episode of The President's Path, and our big announcement for this week is we are welcoming back Brenda Boozman, who is our new co-host.
Hi guys, I'm very happy to be back. It's been a while.
New old co-host.
Co-host, yeah.
Not that you're old, I mean to say former. You know what I'm saying.
Okay, rewind, get out of that hole. We're all young and youthful. Isn't everyone in DC youthful these days? Well, they sure look that way.
That's a whole nother podcast on the MAGA look.
That's a whole other podcast on the health of the nation, but kind of, I suppose, loosely linked to that. It's flu shot season. We're all talking about vaccines and so on, personally and professionally these days. Of course, the news focus has been on the Centres for Disease Prevention and Control Vaccine Advisory Committee all week, talking about what to do about the hepatitis B vaccine that's currently given to all newborns, that vaccine guarding against Hep B, which can be a very, very serious disease, leaving long-lasting liver damage. But it's prompted a lot of discussion, hasn't it, in general about vaccines, about the impact of Secretary Robert F. Kennedy Jr. on the Health and Human Services Department. So maybe we'll just have a look at the impact he's had and start with vaccines, considering that's what we've been talking about so much this week.
I think one thing to remember when it comes to RFK and the vaccines is that, let's take the issue of the hepatitis B vaccines at birth, for example. I think that plays into a much larger MAHA, Make America Healthy Again, and MAGA issue in terms of parents' choice. Because I think the main objection there from some of his most vocal supporters is that they just don't want a unilateral decision to be taken without informed consent right at the beginning of their child's lives. And I think that's at least politically something that broadly speaking, we've spoken about parents' rights and parents' choice quite a bit in as it regards to supporters of the president and his allies. And I think it kind of plays into that quite a bit.
Yeah, I think if we, take a step back and remember when RFK Jr., when he was sworn in and when he was going through, indeed, his confirmation hearings, he said, for example, that he would not change the advisory panel that in the CDC on vaccines. What he ended up doing, of course, was firing all 17 members of that panel and appointing new members, many of whom reflect more of the vaccine skeptic view that RFK Jr. himself does. He also said that he wouldn't change the language on the website of the CDC regarding the claim that there is a link between vaccines and autism. We know that there are reams of scientific data proving that there is not a link between the two, and yet the CDC did change the language on its website to kind of undermine that science. And indeed, the concern, when RFK Jr., when he was going through that confirmation hearing process and then sworn in, he said that he wouldn't take vaccines away from people. But that was never really the concern. I think the concern at the time was that he and the language around vaccines could sow doubt around the efficacy and safety of vaccines. And many critics, and we've spoken to many of them in our program, say that's exactly what he's doing, is that, the skepticism around vaccines is growing because of the language we see from both the secretary and from the CDC itself, which obviously is the trusted agency for the guidelines on vaccines.
Yeah, loads of really interesting points there, Sumi. And I think particularly this notion of availability and access. Secretary RFK may not be taking these vaccines away, but actually in removing mandates and not making them compulsory, that is kind of what you're doing because of how the health system is set up in this country, right? You're relying on your health insurance to cover you getting these vaccines. Otherwise, they are so prohibitively expensive that it's going to be really difficult for parents to spend a couple of $100s per child on these vaccines. So when the health insurance companies see that there aren't mandates there or they're not recommended for a particular age, And on your point, Bernd, about parents' choice, the choice for parents becomes really difficult then, because it's not like they're freely available or they're not, as it is in other countries, or like in European countries where they're there, they're mandated, they're free. And yes, you can choose not to get them. But if you want to get them, they're there and they're free and they're covered by the government. It's not how it works here. So I think that's why we've seen such a groundswell of opposition from the medical community to this as well, haven't we? Because words have such an impact in terms of the financial ramifications because of how vaccines and other healthcare services are delivered in this country.
I think the concern is also that, if parents are allowed to opt out of a particular vaccine, let's take hepatitis B again, that in a way could undo all the progress that has been made on a certain disease over time. I had a look at some of the statistics earlier, and using that one, the hepatitis B vaccine, giving it at birth reduced childhood infections by 95% and prevented, pardon, 90,000 deaths. So I think there's a concern in the medical
Mm.
community that all that progress, which took quite some time to get to, it would be undone if parents are can opt out over time. I think that's something we'd have to wait, maybe decades to see in data though. But I think that's the fear.
But I mean, we see that in real time with measles, don't we?
Yeah.
There's already been, people not getting the measles vaccines for their kids. And we're seeing a disease that was eradicated in this country come back and cause deaths of tiny children.
And actually 3 cases of whooping cough as well in the state of Kentucky, of 3 infants who have died from that disease as well. And this is very much, the former CDC vaccine expert, Dr. Fiona Havers, who we've talked to on our programs many times, she resigned from the CDC more or less in protest of RFK Jr. firing back in the summer the members of that advisory committee on vaccines. And she said, look, the impact of this is very real. It does lead to lower vaccination rates and the possibility of these types of deaths. I'm interested to hear what you guys think about what RFK Jr. has said here, because he has made clear that, he has these long-held views, skepticism of vaccines, and he wants his new panel and the department as well to look into what he sees as possible links between childhood disease, autoimmune disorders, things like eczema, and then, of course, as we mentioned previously, even autism and vaccines. And yet, he says he's using the gold standard of science, and scientists we are speaking to are really raising the alarm, saying the science here is pretty clear.
And also, I don't know that there is public support for his approach. I know, Bernd, you were talking earlier about the parents' choice within the very staunch kind of MAGA group or MAHA group of people. But our editorial partners here at CBS News did a big survey at the end of August, start of September, when there was very much that focus on the combined MMR vaccine. And the results of that, I just have them here in front of me. 91% of Democrats felt the US government should encourage children to vaccinate. 68% of independents also felt that, and 57% of the Republicans surveyed still felt the US government should encourage parents to vaccinate. So there is a majority there, regardless of political persuasion. And what I've heard from doctors and physicians and health groups in the last couple of weeks is they now feel that the CDC and to an extent the FDA, which were, the gold standard recommended bodies, if you had something or a medication, you go and check it out on their website. What is this recommended? Is this not? Is this a good treatment? Is it not? That they're now saying you cannot trust the word of those government agencies, that parents should only be trusting the word of their pediatrician, of their physician, which is just an extraordinary position for these medical professionals to be putting forward, that, a government agency funded by taxpayer money to examine science, make recommendations in the best interest of the American public, things they've been recommending for decades, to suddenly not do that, to the point where trust is undermined in them so significantly. It's quite astonishing to watch it happen.
I think perhaps the most kind of stark example of that also is for the first time in 80 years of the CDC's existence, you had a coalition of states, Democrat-run states, saying that they would kind of develop their own vaccine guidelines, which I just think shows that how politicized medicine and healthcare has become in this country. I mean, even when you look at polls about support for the Maha movement, I saw one poll from KFF which said overall 4 in 10 American adults identify with it or large portions of it. But it's the differences between Republicans and Democrats are very, very stark. Republicans are much more likely to identify with what he's doing than Democrats are. And I think, that just shows how deeply politicized the healthcare debate has become in the States. It's almost moved away from just kind of medical evidence and experimentation, I suppose.
The Republican strategists I've spoken to have said this polarization, this politicization of medical care, of healthcare, you can trace directly back to COVID and to the pandemic. And they say that mistrust in the CDC, in public guidance at the time, was born from that time. In fact, I was speaking to a strategist on one of our programs yesterday who said, look, RFK Jr. is the direct answer to Dr. Fauci, because there is this incredible vitriol among some let's say some MAGA-based supporters towards Dr. Anthony Fauci and the actions taken by the CDC during the pandemic. And they see some of the guidance that at the time, as science was developing around the pandemic and the understanding of how it was spread and how vaccines were developed and what was, right for social distancing, they see that time as having been incredibly politicized in the types of guidance that was given, and that this is the natural reaction to that. It's very hard to say because, of course, the guidance given by the CDC at the time still stands, that the vaccine has prevented so many people from dying or getting very sick from COVID, that masks did help contain infection, but regardless, that link is made.
I was to say to that point, I also think one of the pandemic hangovers, if you will, is that RFK is also under pressure from some people who think that the MAGA movement isn't doing enough in terms of what he promised for making America healthy. Online, for example, there's a really spirited group of people who are saying that part of what they wanted when they elected President Trump and with RFK as one of his representatives was that people who enforced mask mandates, for example, or pandemic vaccinations at the time, that they be punished. So from he's also under pressure from some to his right who think that he's not actually going far enough to redress some of those wrongs from the pandemic, which I don't think is a tremendously minority opinion in large parts of this country, that things were handled badly and then no one was necessarily held responsible.
But what you've seen in this country in reaction to COVID and the pandemic and so on, you haven't seen in other countries. Like, you haven't seen a backlash against childhood vaccines in other countries, even those who do have, had a vocal anti-vax campaign at the time of COVID. It hasn't followed through to the way it has here, that the power that RFK has over the Health and Human Services Department, you're not seeing that in other countries. And I think whatever deal was done between President Trump and RFK Jr. on the campaign when Kennedy dropped out and gave his support, that he was kind of given carte blanche in the Department of Health and Human Services as a result. And I mean, if we remember all those comments he made with the unproven links between Tylenol in pregnancy and autism, completely no science to back that up, no evidence whatsoever. But yet the secretary talking about it, the president talking about it in the Oval Office. And the Senate Majority Leader, John Thune, was asked about it at the time. And he said in an interview with MSNBC, "If I were a woman, I'd be talking to my doctor and not taking advice from RFK Jr. or any other government bureaucrat for that matter." Like, that's within the same party. They're saying, don't pay any attention to what the health secretary is saying. It's just, there's a to your points about the politicization, there's a really interesting interplay within the party about who has what power over what sections of the government and what bits of policy they get to do. And, within the health department, of course, it's not just vaccines, right? The secretary let go, in addition to the advisory council you were talking about earlier, Sumi, huge amounts of people, huge numbers of research programs were shelved, grants were stopped to research programs that were underway that would lead to potentially finding cures for things in the future, to improving the public health of this country. A lot of that has been stopped. A lot of public information campaigns have been stopped. One of the first things they did was stop the flu shot campaign last year, didn't they? They stopped a campaign against cot deaths that's been going in this country for decades and has prevented so many cot deaths. They're also rolling back funding on anti-smoking advertising that also has been so effective. So there's just the power over the department that one individual seems to have now. I don't know that we're seeing that same level of power in other departments.
It's actually worth also reminding people that the Department of Health and Human Services, that's exactly right, Katrina. The power is pretty vast because that agency is pretty vast. It oversees the CDC, the National Institutes of Health, the Food and Drug Administration, as you said. It oversees CMS, which in turn oversees Medicare and Medicaid, so ensuring almost half the country. So if you think about the power that Robert F. Kennedy Jr. wields, it's because he is the secretary of this massively influential agency. Everything from inspecting food and medicines and giving recommendations, as you said, to that very important health insurance service. And you mentioned some of the political debate within the Republican Party. Senator Cassidy has come out on social media to say he's not particularly happy with the way the CDC has changed its language around vaccines on its website, or that, completely baseless link, as you said, Katrina, between Tylenol in pregnancy and autism. And yet Democrats have said, well, you voted to confirm him. And so this is kind of part of the legacy of your party's doing.
But that's really interesting when you're talking about Senator Bill Cassidy of Louisiana, because, we remember back to that Senate confirmation hearing, and he made Secretary Kennedy promise not to change the language and not to change the mandates. And now he has. And we see Senator Cassidy posted on X just in the last week or so. I think he's really quite fuming about this. He said, there's no link between vaccines and autism. Any statement to the contrary is wrong, irresponsible, and actively makes Americans sicker. And he has called on Secretary Kennedy to come back in before the Health Committee and sort of answer questions, which Secretary Kennedy has said he will. But, to what does that achieve? Like, they don't have a power to compel him to undo these mandates or these orders, and so far as I understand it anyway.
I think that's very unlikely to happen, just because there really isn't anything that they could achieve other than make things easier for Democrats in the headline. That would be such a PR gift to the Democrats to have a Republican senator and Secretary Kennedy again having that was a very tense confirmation hearing. To do that over again would just add fuel to the fire, and I think everyone would prefer to avoid that, except the Democrats.
Bernd, I wonder, when you see President Trump talk about RFK Jr. or host him in the White House, do you sense at all that his support for him has changed as some of these controversies around these vaccine policies have developed?
I don't. President Trump is, he often sidesteps those questions, but he does delegate authority quite well to his cabinet. But I think he's, the administration is also very conscious that among some demographics that they really need for political success, Secretary Kennedy remains fairly popular. Young men, for example, young conservative men, for example, he remains very popular. And the Make America Healthy Again movement actually has been a little more resistant to shifting opinions than the broader MAGA movement, if one looks at the polls.
We should say as well that some of what Secretary Kennedy has done has been broadly welcomed by Democrats and Republicans when it comes to improving the quality of the food in the US, bringing it, I'll say, more in line with the standards in food in Europe. So there's a lot of very positive movements there that will contribute to the internal health of American children as well.
Yeah, that was always welcomed, in the very beginning when Democrats voted against the confirmation of RFK Jr. they said, look, it's not a question of making American food healthy again. We all support that. They were far more concerned about the first part of what we discussed, the impact on vaccines and medication. But there is, as you said, Katrina, broad support for the understanding that the American diet simply isn't very healthy. The quality of food often, for ultra-processed foods, let's say, isn't very healthy either. It's been interesting to see the health secretary really promote certain aspects of what he sees as, healthy food and healthy eating. He promotes, beef tallow being used instead of vegetable oil. And I think he was out at a restaurant or made a point to go eat at a restaurant that is now using beef tallow to fry French fries instead of vegetable oil. So it'll be interesting to see how food guidelines change and how that's reflected. He says he's a big meat eater, for example, how that will affect some of the guidance on fats, saturated fats, and how that will shape his Make America Healthy agenda. But all in all, I think that's a point where most people agree that it's an important issue that he's tackling.
I think the most telling thing with that is that the city of San Francisco, which has generally been pretty hostile to almost everything the administration has done, is suing food companies over ultra processed foods, using very similar language to what Secretary Kennedy has said in the past. So I think, in terms of items that haven't been politicized, I think that's one that's actually kind of been one of very few unifiers between the administration and local or state administrations that are generally, quite displeased with what's happening here in Washington.
Although I will say that there has been criticism from some Democrats who note it was Michelle Obama, when she was first lady, who planted a vegetable garden and received quite a bit of criticism or not support, let's say, from some Republicans for her push for healthier eating for children.
If we're talking about the politics of healthcare, I mean, top of the list in these next few weeks has to be this agreement that they have to reach on healthcare subsidies, right? They've got to do something by the end of the year, or healthcare policies are going to rocket for the American people. They're supposed to take a vote on it next week, but it looks like they're as far away as ever on reaching an agreement whether to extend those Obamacare subsidies as they're known, or fall off a cliff face, essentially.
There's been a lot of stopping and starting on this one, hasn't there? Because we've gotten some rumblings from Congress that there are some bipartisan agreements on a possibility to extend these subsidies. And then again, it seems like you said, Katrina, they've gotten nowhere. In the end, what we've seen in this congressional session is that President Trump has to have the final say. And
we don't know what his say is, though, yet.
Well, that's precisely it. Yeah. And I think until we hear that from the White House, it's going to be difficult for House or Senate Republicans to make any sort of move on extending healthcare subsidies. And they keep insisting that President Trump has insisted that he has a healthcare plan that he wants to see replace Obamacare. We've not seen what that plan is. We haven't seen a plan from other Republicans either. So until there is some sort of plan, the question of these subsidies will be all the more pressing.
I hate to go back to polls, but when you look at the polls, there certainly seems to be a disconnect between Republican voters and how they feel about extending those subsidies and what's happening on Capitol Hill, which, if I was a Republican strategist, I think would be quite alarming, in that a very significant majority of Republicans want those extended, and a failure to deliver on that promise would be damaging to the party on Capitol Hill.
And it's a tough one because all the pressure about cost of living and affordability, doing something or not doing something that would cause people's healthcare policies to suddenly become really expensive as well, in the round could actually play very, very badly for Republicans, because at the end of the day, it's more money coming out of your pocket, right?
Yeah, I have a sense this is a crunch that we're going to be talking about on the pod in the weeks to come. Yes. Of course, it was the very reason Democrats say that they voted against reopening the government for several weeks. Mm-hmm. So let's see if there's some compromise reached, but that might be for the coming weeks.
Or deja vu.
Well, great to have you back, Bernd.
Welcome.
Nice to be back.
Yeah.
See you guys soon.
See you guys next week.
See you soon.
If you enjoyed this episode of The President's Path, then like and subscribe to our YouTube channel. We would love to hear from you. So do please leave us a comment below or email us on path@bbc.ie. www.ecc.co.uk.